My name is Robert Lario, and I'd like to welcome you to the Business Process Management for Healthcare Industry Workshop. Before we get into the actual body of the material, I'd like to introduce you to our sponsor, Red Hat, Ben Cushing. Ben, you want to?
Yeah, this is Octave.
Hey, good morning, everyone.
Hi there. So we're here from Red Hat. I'm a lot louder than you are. We're really excited about this. This is a huge opportunity to have collaboration in the BPM space across a whole lot of different industry and institutions. So we're just really happy to be a part of this. For those who don't know or are wondering why Red Hat's involved at all, we don't just do Linux. We also foster the open source community for JPM, which is the most widely used runtime and BPM engine that's out there. So it's a big part of our fabric and what we care about when we apply our energy and efforts. Look at anything.
Good morning, everyone. Really excited to be here. I'm the CTO for Healthcare North America. Just so you guys know, we focus in healthcare for 3 different areas. I call it, first one is IT simplification and compliance. Second is population health. Third would be connected care. That's where folks leverage our portfolio of technology to address some of the critical issues that they're trying to solve. And it's all about, in healthcare, from my perspective, value transformation. Not like digital transformation, it's all about lowering the cost of providing care and at the same time improving the efficiency. From that perspective, I would mention that I've had about 20 years experience with BPM space, and I'm very excited about the work we're going to do here, and my only thought coming into this is we have to capture the 5 W's of defining any clinical workflow, which is the what activity you're doing, where you're doing it, when, time-based, who's the roles that are going to be involved in it, and under which conditions those things would be done. In my experience, I've never been able to use any template from out of the box and apply it as it is. It's always gets customized. So as long as I think we are capturing the critical path and the key steps that need to happen, rest will follow from there. Thanks.
Thank you. So, change. Already suffering technical difficulty. It's not a good auspicious start. This should be.
I don't think your slides are up.
That's my first slide. But it won't.
Fill the gap here. So
So do the arrows happen?
No.
Yeah, it's. I think
part of the fostering of the open source community for us at Red Hat also includes when you need to actually run these BPM models at scale, part of what we do is we harden the actual open source tooling that you would use for that. So patches and updates, things like that. Security flaws, we take on all that responsibility and make it enterprise ready. So just something to keep in mind.
I'm going to go this way.
Thanks for tap dancing.
Okay.
Well, that'll be our last technical difficulty for today. I wanted to start off and kind of ground the conversation in what we're doing here today. And many of you have probably seen this slide or a version of it. And this is from a presentation that Stan Huff gave a long time ago that really had an impact on me. And the first time I saw it, I remember looking at this and trying to figure out what I was seeing visually. And it wasn't until Dr. Huff pointed out in the upper left-hand corner that there's a baby in this picture that I, first of all, realized this wasn't a storage closet, and further realized how, in a picture, how complex healthcare is. In a single picture, this sort of showed me, what bioinformatics and all the things that go on and have to be solved and the issues that can occur in healthcare. And he went on to talk about a study that many of us have heard about that was performed in 1999 from the Institute of Medicine. It talked about that between 45 and 98,000 preventable deaths in healthcare due to medical errors occur every year. That was in 1999. This paper was published in 2013, and they've gone on to actually say that it's over double that, around 250,000, and even possibly as high as 400,000 preventable deaths in the U.S. alone. And what was interesting in that statement, or that paper, was that if you were to include that in cause of death, that would mean that medical error is the third most common cause of death in the United States. Now, we don't report that, but we report cancer, but not medical errors. And this is what caught my attention to get involved in bioinformatics, and why we're here, because I think that what we do, in a small way, we can help address this problem by interoperability, by standards, and bringing consistency to the information that clinicians use in delivering care. So with that, I'd like to introduce Ken Rubin. He'll be our first speaker of the day.